This is a CJASN podcast, and I'm Dr. Rachel Patzer, a professor of surgery and medicine and the director of the Health Services Research Center at Emory University School of Medicine.
And my name is Dr. Stephen Pastan. I'm a professor of medicine at the Emory University School of Medicine and the medical director of the Kidney and Pancreas Transplant Program here at the Emory Transplant Center. We're excited to have the opportunity to share our work in this podcast.
So for several years, we've focused our research efforts to reduce inequities that exist in access to kidney transplantation. In 2014, a new kidney allocation system was implemented that changed how transplant waiting time was calculated by backdating from the start of dialysis rather than from the time of placement on the waiting list. Because Black patients have historically had longer time on dialysis prior to waitlisting, this policy was expected to impact racial disparities in access to transplant.
We recognize it was important for kidney providers to know about the new changes to the allocation system. This led to the development of the ASCENT Quality Improvement and Educational Intervention. And ASCENT stands for Allocation System for Changes in Equity in Kidney Transplant.
So with a multidisciplinary dissemination advisory board, we developed an intervention and delivered it to 655 dialysis facilities across the nation that had historically low rates of transplant waitlisting. Facilities were randomized to receive either the ASCENT intervention or an educational brochure. And the ASCENT intervention included a feedback report about their transplant access, a medical director webinar, and educational videos for both staff and patients.
We found that while waitlisting did not significantly differ between the intervention and control groups after 1 year, differences were observed by race.
Right, so what we observed were that declines in racial disparities in waitlisting were at baseline, and these racial disparities were actually attenuated in the intervention facilities, suggesting that equity and access to waitlisting was improved after the intervention. And we think these results highlight the value of a community-based approach to disseminate targeted information about a policy change relevant to the kidney community with the goal of reducing inequities in transplant access.
It's our goal, through continued work in collaboration with members of the kidney disease community, to create an equitable system.
I want to close by thanking our co-authors, our community advisory board, and also the Clinical Journal of the American Society of Nephrology for the opportunity to share our work.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.